Okay, so performing a physical exam, we're going to have Optimus Prime demonstrate for y'all with all of our different types of materials, as well as positive reinforcement. So we're going to go through the process of everything we've talked about in class. The first part of our physical exam we know is hands-off observation. So our patient is very much BAR because he got some peanut butter. He seems that he is doing A-okay with his overall demeanor as well. So mentation, BAR, demeanor, happy, friendly, comfortable. He's not nervous, he's not anxious, he's a real good babe. So of course our restrainer has him in forklift hold for his best abilities at this time. We know that is our preferred physical exam restraint method most of the time, as well as for vaccine administration, various types of injections, medication administration, ocular diagnostic exam performance, like our fluorescein eye stain and our Schirmer tear test. Optimus has a tendency to get excited and move around and wiggle, so he's going to be in this position for a little bit, so we'll see how he does overall. But our first method of our exam, overall physical exam that we're going to do, it has to do with our vitals now, since we're going to be hands-on. Our BCS, which we know is our body condition score, is part of our hands-off portion of the physical exam, but whenever we do the actual physical exam, you need to be hands-on too, and you can feel the BCS scoring as well. It's not just looking at them. Having Optimus with the way his coat is very short, his weight looks really good, he has a good BCS of a 3 out of 5. We know we use 5 as being obese, very overweight. VTIs very well is common in clinics. You can see people use a BCS scoring chart out of 9, but that leaves way too much room for subjective discussions on that. So we're objective, straight to the point, limiting our subjective decision window, and we do out of 5. So for him, if I'm hands-on, I can feel it. If you are performing a physical exam on like a St. Bernard, a Chow Chow, for example, an English Bulldog, it's going to be a little bit more difficult to visualize a physical exam than to only do hands-on. So it just depends. Give me some peanut butter. Just a little bit, just a little. Yes, I know. You're a good boy. Okay. So the first part of our overall hands-on is going to be our vital attainment. So we know we're going to observe our mucous membranes for our color and consistency, our CRT, which we know is our capillary refill time, to observe our tissue perfusion. We know normal for companion animals as well as large animals is less than 2 seconds. And we're going to proceed through the rest. So if we are doing our overall vitals observation now, I need to make sure my restrainer is ready for me, that I can work with Optimus. I'm going to stay off the side. I may move around because we have a limited area for you right now to do this. He's your good boy. So looking at him, he has a nice CRT of less than 2 seconds. His mucous membranes, they are nice and pink, as we know is normal, but as well as they are slick. For him, they're slick because he was eating his peanut butter. That can affect that slightly, but it's not a big deal when it comes down to an exam, because we know that's something that we just did, was offer him peanut butter. But also with Optimus, he gets very excited, which makes him salivate a little bit more. So right before coming to do his physical exam demo, he got very excited thinking he was going out the door, to go on a WALK. So he's going to be slick, but they're appropriate. We're also going to do our cardiac auscultation. So we know that Optimus can't have treats for that because I'll hear him eat his treats. So we know we need to do bilateral cardiac auscultation beginning on our left side of our thorax, working our way to our right. Listening for our normal lub-dub sounds as well as potential abnormal sounds, which Optimus does not have any abnormal heart sounds, which you would refer to as a heart murmur. Severity grades 1 through 6, 6 being the most severe. What else will take you? We know PAM is on our left side of our chest for our pulmonary, aortic, and mitral valves. They all sound within normal limits, and the restrainer does not have to move for me to auscultate the other side. I'm just simply going to go to that side to auscultate the tricuspid valve, which sounds normal as well. So I'm going to go ahead and get his heart rate. heart rate is 60 beats per minute, which we know is normal. No, sir. Anyone get his pulse rate, which we know we have to auscultate the same time. Can you hold him, please? As palpating the femoral artery, which I'm palpating on his right hind limb. So Optimus, leave it. I need to hold his head. His heartbeats and his pulse match right now, so I'm gonna go ahead and get his pulse rate. And his pulse rate is also 60. So we know that matches. His pulse quality is strong. We know we have weak, moderate, strong, or bounding as our potential options, but we want strong. Of course, having thick thighs, like he does, makes it a little bit more difficult with that digital pressure. So going from here, I'm gonna give him some positive reinforcement because he doesn't like to sit still very long. Leave it. Easy. There you go. We're going to go ahead and do his respiratory auscultation. So we know our initial starting point is our trachea out of preference. Does that mean everyone does that in clinic? No, they do not. If you have to do a normal respiratory auscultation, but you're in a hurry, you don't always have to start at the trachea. It's best to be in the good habit of that. And we have our 9 lung quadrants after that on each side of the chest, which we know we start on the left side always after that. So we'll have 1, 2, 3, 4, 5, 6, 7, 8, 9. And then we'll go to the right side afterwards. We know we should hear normal respiratory sounds when he inspires and expires, as well as for cats. It's the same concept. Go to his trachea. Let me listen to your trachea, babe. Hold still. Leave it. Optimus. He sounds fine. So I'm going to go ahead and listen to his respirations before I obtain the rate. He's very calm and collected, but he can't hold still very long, which a lot of our patients are the same way. He sounds good. I don't hear any crackling, which would indicate fluid within the alveoli. I don't hear any wheezing, which would indicate potential asthmatic concerns. So we're also going to take the other side. So 1, 2, 3, 4, 5, 6 for his quadrants. And 7, 8, 9. Stay. So he sounds good. We give him some peanut butter because he's having a hard time. Over here, over here. Stay over here. You good? Now we got to get his respiratory rate by observing him. So maybe we can watch his chest go in and out. So inspire, expires 1. Inspire, expires 2. So we do the same mathematical configuration for 15 seconds, multiply our findings by 4. So looking at Optimus, I put my hand on him. Of course, he licks his lips. That can potentially affect it. So there's 1, 2. You need to hold him up, please, because he's trying to find peanut butter on the floor, which isn't there, so I have to start over. Which is fine. You know, we can start over on respirations and our cardiac overall auscultations for heart rate. 2, stay big. 3, 4, 5, and it's a big one, 6. 6 and 4 is 24, and we know that's normal for him. So no concerns there. But he is just all types of excited. Can you please forklift him some more? Push him forward slightly. We're gonna get our rectal temperature. It's our next part. Are you ready?
Yeah.
Don't let him sit. So we know the proper way to acquire our rectal temperature. This isn't peanut butter, son. No.
Stay.
Okay. Stay.
Stay.
We don't put peanut butter on the walls at school, but I can for his sake here at the house. So that's fine. You ready?
Yeah.
Hold him right. Okay. So I'm gonna go ahead and insert the thermometer, but I let Optimus know I'm here. 1, 2, 3, inserting. I go straight, and I tilt to either the left or right side, so I make sure the tip of the thermometer is touching the rectal wall, so I can have a more accurate body temperature requirement. We know the rectal temperature acquired method is more accurate than the axillary or aural. For the ear, this is the most preferred method. He also needs his anal glands expressed, so I can smell. Coming out. Rectal temp is 101.1 degrees Fahrenheit, which we know is normal in our companion animals. Good boy. Good boy. So now we're going to go ahead and proceed with the rest of our exam. We're going to do our ocular exam first with our ophthalmoscope, which he thinks has peanut butter on it because it did. So I have it set with our lighting. So we're looking OU for any type of ocular discharge, whether it's unilateral, bilateral, the character of it. Is it going to be any particular color and consistency? He's a good boy. You ready? A lot of times they're pretty okay with this. Optimus gets a little wiggly. Stay. Optimus. Stay. Good boy. No. And his look fine. Good boy. Let me see. No ocular discharge. Let me do your pupil. Optimus. Hey. Optimus, stay. You need to hold him. Put your arm around his neck and elevate your elbows slightly. Just slightly. Easy. His pupillary light reflex is normal. I'm going to go ahead and do his palpebral reflex. So I'm going to tap lightly on the medial canthus of his eye. It should solicit a blink response. Hey, no sir, hold still. Here. Good boy. Yep, and it does fine on both eyes. His menace reflex, I'm going to go ahead and do one with my hand, so you have to cover the opposing eye. But not put wind, air into his eye as you're doing it. Optimus. Leave it. Leave it. We know we can use a cotton ball and drop in front of him and watch him observe that. It's primarily what we do for cats. So he stares at it, you got him. Nope, leave it. And also he thinks there's peanut butter. And he's watching my hand instead of the cotton ball, so it doesn't always work in our advantage. But his menace reflex is fine for both of his overall eyes. Stay. So I'm going to go ahead and do his, that's fine, his Odo exam and his nasal exam. His nasal cavities look fine from what I can see, rather his nares. He doesn't have stenotic nares. I know that he has good breathing patency just by observing the way his tissue is. They look fine. There's no nasal discharge, bilateral or unilateral. There's no character or consistency to address of that as well. He looks fine. He doesn't like his ears messed with very much, just because he has that every so often ear infection I've mentioned before. So I like to keep him distracted as much as I can with that. But he's a wiggle worm. So his restrainer has to be ready for him when he starts to wiggle on him. You ready? So we're gonna look at this one first. So I'll hold the pinna, insert the ear cone. No concerns in that one. Good boy. Go on this side. Yep, stay. Awesome. You ready? Stay, babe. Stay.
Stay.
Let me see.
Stay.
Let me see. Same thing. Oh, is that ear bothering you?
It's okay. It's okay.
He does have a little bit of discharge, exudate, debris. AS. It's a little inflamed on his skin. This is the time of year I mentioned. He also has this every so often ear infections. So we have his medication his doctor has prescribed him to use whenever this takes place during this time. So we'll have to begin his medication. My goodness. So his oral is complete. His oral cavity exam needs to be observed, but he is super wiggly. Also potentially because the weather outside has a really big influence on how they act. He doesn't have any storm anxiety, anything like that, but it can affect their overall demeanor. He can sit. If you can get him to sit and he stays there, that's fine. Stay. So I need to look in his mouth. You ready? See if he'll let me. And do you know he's got a lot of peanut butter in there? Which we wouldn't want during a real oral exam. Let me see. So you'll use the incisors, open the mouth. Good boy. And he looks fine. He doesn't have any visible foreign objects when it comes down to it within his oral cavity around his teeth. His teeth are all present, but I need to look under his tongue. Optimus. 1, 2, 3. Let me see. Yeah. His tongue looks good as well. So I need to examine his coat, his skin, his overall body. So if my restrainer can hold him in forklift over here for me, this way, and I'll give him some peanut butter on the wall. Oh, here, here, babe. You are so excited. Ready? So I kind of have to hover for this one because he's on the floor. The restrainer said he's ready. So I'm looking at him, feeling his coat. It's nice and soft. I don't see any potential concerns with him. I can only see so much. I like to look at their coat, their nails and nail beds all at the same time if I can. I don't see any ectoparasite concerns on him. No fleas, ticks, anything like that. He does have a small callus. On his right hock from laying in his kennel. He's a good boy. Let me see. He does have a healing lip granuloma on his left hip, lateral aspect of his hip. Trainer used to do forklift. Have him?
Yeah.
Good boy, Optimus. I know, baby, you're okay. And sometimes they don't like you touching their feet. They'll be a little foot shy. That's okay. Let me look at this side a little bit.
Want to turn?
Yeah. As long as you can get in there. You can turn this way if it's easier for you. Come here. Turn this way. Come see me now. Come see me. Good boy. Okay. Good boy. Stay. Stay. The exam tables have their benefit, that's for sure. Good boy. Let me see. Can I see their leg? Oh, that was me. Good boy. Let me see. You've been licking? See, I like to lick the inside of my paws every so often. So he has a little bit of that color we talked about, the orange brownish tint on his fur within his paw pads. See this one, babe? His nails look good. Got some mud stuck between some digits. He does need his bath. Good boy. Okay. All right, stay there. I'll come on the other side. Or you can turn around. I can get more peanut butter on the wall. That's fine too.
Here.
Here, come this way. Come. Come. Turn. Here. Good boy. Need you to be in forklift, you goofball. They'll be just as active in clinic, so this is a good demonstration for that. Forklift.
Optimus.
I'm going to check him for any types of lumps or bumps. Ready? And as I was feeling him, I didn't feel any concerns for that, so I'm going to do his limb palpation at the same time. Everything feels symmetrical, no lumps or bumps in this region. No lumps or bumps are here. He does have a scar from a surgery that you can feel. He does have a lump. It's a lipoma, previously diagnosed not too long ago, on his left side near the center dorsal aspect. About this big. It is loose, so it's not connected to the muscle. Typically lipomas are under the skin, and it's soft, which is good too. Good boy. His limbs feel good. Woo.
Okay.
Optimus. You good?
Yeah.
His joints feel fine. I already looked at his nails and paws. So now I'm going to do his conscious proprioception test. So the conscious proprioception test, remember, that's when we take their paw and we put the dorsal aspect on the ground and we see them reset it. It should be rather quick. When they do that, our restrainer knows that they're not going to fully support their weight, but they're also not going to let them fall down if they don't feel and have a potential proprioceptive deficit. Optimus, stay, babe. So I'm going to take this paw first. And he's leaning into you, so, yeah. He's also a little foot shy, but he's okay, he feels it. Being close enough, I can see that. And it doesn't matter which one you start with or where you go next. It's nice to do both at the same time, but at this positioning, I'll adapt and I'll just come this way. And I'll still support him. Doesn't want me to touch his paw. Definitely feels all of that. So I'm gonna go ahead and do this one back here. He's trying to lean all his weight. Good boy. Do this one. Leave it. And sometimes they're not gonna want you to do it, so you have to do it a few times. Optimus, let me do it, baby. That one I know is fine too. Good boy, okay. So we're gonna palpate his lymph nodes. As his conscious proprioception is fine. He's got 5 sets of lymph nodes we're gonna look for, so he needs to face that way as much as possible. So that we know we do a symmetrical palpation to confirm if we have any lymph nodes present, if they're both present, if one's more enlarged than the other one, so on and so forth. So submandibular lymph nodes right here underneath his mandible, hence the name, submandibular. The salivary glands are also in that region, commonly confused. Stay, you can hold him by his neck. Optimus, you're being very naughty today, sir. Okay, he's fine, he can sit. Optimus, what are you doing? Here, get him to stand. Optimus, up.
Optimus. Come here.
Turn. Turn.
Good boy.
They think you're good all the time. There's proof that he's not. Optimus, you don't actually deserve this right now, but we need to palpate those lymph nodes. So you need to stand up. Okay. So we palpated submandibular, going prescapular, so we have to get in our partner's bubble, so our partner can move out the way just a little bit. Don't feel those. Our axillary, we know within our axillary region, hence their name as well. Don't feel those. Coming back. Inguinal, they're pretty medial within the region of where our femoral artery is. I do not feel those. And our popliteal, don't let them sit, are near our stifle region. Not the back of our hocks, not the back of our tarsus. They're near our stifle. Stifle involves where the knee is. Don't feel those. So those are good. You got him. Lift his arm slightly. Okay. Lift this arm slightly to not let him sit. Stay. I'll give him some more peanut butter because I need to do his perianal exam. And he likes to sit. Okay. Cranial exam. Ready? So I'm just going to look at this general region. Don't see any complications here. Everything looks fine. No dried feces, no potential intestinal parasites, no blood present. Anal glands are definitely going to be full. I can already smell them. Sometimes if they're full enough, you can see that they're full, but for him, you can't see that because they were expressed not too long ago. So those look fine. His rectal exam I can do as well if I needed to, but technically we know that's a doctor thing. We don't always have to do a rectal exam, but if we're doing an anal gland expression, we might as well, because you're still going to use your index finger, don't let him sit, and be able to do a 360 palpation of the rectal region. His genitals are next to examine. He is a neutered male, so his scrotum feels fine. We know if he had his testicle or testicles, we would have to palpate them and feel for any potential enlargement symmetrically, as well as if they are warm to the touch. If he was a cryptorchid, if he's unilateral or bilateral cryptorchid, we have to notate which testicle we feel is actually retained, or if they are both retained. We know for the rest of his genital exam, I need to look at his penile sheath and his overall penis, if I can. We know sometimes it's going to be difficult to do. For Optimus, I have a feeling it will be. So overall, ready, Bishran? I'm going to come down. I'm looking at his penile sheath. For any potential lumps, bumps, discoloration, everything feels fine so far. Look within the prepuce to the best of my abilities. No abnormal discoloration, no inflammation. He's trying to sit. He does have a little bit of schmegma, which we know is normal within our intact and neutered males. And to extrude his penis is making him very uncomfortable. So for Optimus specifically, he may have to have a little bit of sedative to actually make this work enough, as well as being potential lateral recumbency. But everything else looks fine. So there's our physical exam. How that works, we know that's a very thorough physical exam. Our version that we do is kind of a brief version, as we've talked about, to that of a veterinarian. So this is a full veterinarian physical-based exam. Overall, ours is very much similar, but we have to know all of the parts, we have to know what to do, we have to know what the doctor's doing, why they're doing it, and all potential findings that can result from that. So overall, Optimus did a pretty good job. He looks clean, he has a good clean bill of health. He does need his anal glands expressed, is my only notation of potential abnormalities coming up. If he is able to have his anal glands expressed, we know we look for abnormalities and which anal gland is being expressed, if they're both full, if they are not. Abnormality would be if we have blood present, pus present, enlargement, if he has a potential anal gland abscess, which one it would be in, if it's in one or the other. If he had an anal gland rupturing, as well as we have discussed. So it just depends on how that goes. But for our full physical exam, we do have a template that we write on for our patient records, or it may be digital in the computer. So we always record both normal and abnormal findings. If something is normal, you must record it as normal. Otherwise, if you leave that blank, it may look like you skipped it or you just forgot to write down your notations. If something was abnormal truly and you didn't record that, you are held accountable. Otherwise, that is it. And he's a good boy. He's all done. Oh, yes, you're a good boy. Go say hi. Yes. All right, hope that helps. Follow your template I provided for you and everything will work out.